You will take 5 deep breaths in, and each time you'll hold your breath for 5 seconds. On the 6th deep breath, you will take it in and you will do a big cough and covering your mouth, okay? You will do this twice.
So before the days of COVID-19, and even still so, my primary function is working with those with chronic or lifelong heart and lung conditions, namely asthma, COPD, congestive heart failure, those types of things. I think we're using our knowledge and education around the regular things that we deal with and applying it to COVID-19, knowing the potential complications that may occur if you do obtain it. You know, deep breathing exercises very seldom do result in any kind of negative result. So obviously, if people have concerns, if they do have COVID-19, I recommend that people do consult with their physician or an allied health like myself for some specific advice, because they may have a health condition that warrants some extra advice or consideration. Having said that, if it's an assuming healthy person who's trying to do their best to recover from COVID-19, especially if there's someone who has a lung infection or things like that, doing some deep breathing exercises and some coughing exercises, on a standardized basis is not overly harmful, provided that they, don't do it to the point where they become very short of breath or put themselves in harm's way.
And then you will then lay flat on your bed with a pillow in front of you, taking slightly deeper breaths for the next 10 minutes, because you've got to understand that the majority of your lung is on your back, not on your front.
In terms of COVID-19, people coming in with shortness of breath that don't require immediate intubation, but do require oxygen therapy, we are seeing a shift in breathing techniques in terms of having them lay on their stomach. And that sometimes helps with expansion in different areas of the lung and helps with the transfer of oxygen from the environment into the bloodstream. So that in itself is a new technique that we're doing with patients who do not require intubation. I would not recommend doing it at home, because what it does is it delays them coming in if they're short of breath to the hospital, and it's extremely important for us to be able to monitor their oxygen levels.